Hi, I'm Andrew Rodriguez, and welcome to Psychobible, babbling about psychology and theology. Okay, so I was recently doing my training on identifying and reporting child abuse as part of my continuing education as a psychotherapist, and I'm going over the slides about the definition of child abuse. And I can't help but think about the current guidelines being pushed by the transgender activists for kids with gender confusion or gender identity conflicts and gender dysphoria. And the question comes up, is gender reassignment or gender confirmation procedures and transition child abuse? So, let's look at the definition of child abuse and the different categories and types of child abuse, and then let's look at the evidence and figure out if the transgendering of children counts as child abuse. I'm indebted to Andre Van Mol, a doctor who's done a lot of research on the risks of the transgender movement, and I've seen him speak at a couple different conferences this past year. So I am not afraid to say I am borrowing heavily from his notes, and he does a nice job laying out the different risks with each of the different levels of transition. The first type of child abuse is bodily injury, which is defined by there being significant pain or impaired functioning, whether it's permanent or temporary. Alright, so now let's look at gender affirming or transgender affirming treatment. And there are 4 levels of transgender transition. Social, which is to help a child identify socially as the opposite sex or some other sex or non-binary or something in between, in such a way that is convincing to other members of the population. There's puberty blockade, so that's stage 2, or the next level, which is to take drugs to impede the natural process of puberty. Then there are cross-sex hormones, which is really giving more hormones through drugs that belong to the opposite sex. So it's literally wrong sex hormones. And finally, there's sex reassignment, which they're now trying to call gender affirming or gender confirming surgery. Now, these treatments might not necessarily cause significant physical pain, though I would assume some of these surgeries definitely cause pain that is ultimately unnecessary. But let's look at the impairment in functioning. Now, this is important to understand that functioning, the understanding of bodily functioning, is contingent upon understanding the teleology of the body, meaning that your body and the parts of the body have a purpose. There's an ends for each part of your body. Like your eye is meant for seeing. What we're seeing now in medical institutions is training doctors to not look at the body teleologically, but to now see it as, ironically, that the eye just happens to see. It's not designed to see. Definitely not. That would imply a designer, a god. Not even that. It evolved to see, and that's its purpose. Its adaptive purpose. No, in our postmodern world, it just happens to do that. So it could also do any other thing. Therefore, your genitalia, your gonads, your secondary sex characteristics, they just happen to be related to sex. They could be used for anything else that fits your own agenda. So that's the mentality now that is invading the medical institutions, the educational institutions, and so it's setting the stage for people to redesign the body to do whatever the individual wants, or what the parents who may be corrupting their child and steering their child a certain way want. But if you will, just please at least humor me in starting with the assumption that your body has a purpose. And there's a teleology, so there's a functioning, there's a way your body is meant to function. So when we take puberty blocking drugs or puberty blocking agents, PBA, when those are given at Tanner stage 2, which is about ages 11 to 12 for boys, age 10 to 11 for girls, it likely causes infertility. And we really don't know how reversible this is. They constantly tell people, oh no, it's reversible, they'll catch up if we stop taking these drugs. No, you're stopping a natural process that is necessary for the normative functioning of the gonads and genitalia. So right there we see that the puberty blockers impede the functioning of your body. There's also evidence of puberty blockers causing early menopause in females. And so if we follow the trajectory from puberty blockers to then cross-sex or wrong-sex hormones, we assure sterility. So you're telling a kid at age 10 or 11, well, if you start this process, you likely won't be able to have kids when you grow up. And this child is likely not really thinking about having children. So they're making a life-altering decision that cannot be reversed later in life at an age that they really don't know what they're doing. And they cannot give adequate consent. When you understand some basic facts, that your body has a function, your body parts are designed to function in certain ways, that your eyes are meant for seeing, your ears are meant for hearing, your heart is meant for pumping blood, your genitals are meant for generating, then you understand that humans are meant to procreate. And these puberty blockers and cross-sex hormones impair that functioning of the body. So I would say the first type of child abuse, bodily injury, check. The next type of child abuse is fabricating, exaggerating, or inducing a medical symptom or disease. Now this one may seem like a stretch, but the reality is the whole concept of a gender identity independent of biological sex is utter fabrication. You do not have a sex and a separate gender identity. This whole idea of identity being something subjective is a complete postmodern misuse of the word identity. If you look at the roots, the etymology of the word identity, it means to be the same as other members of a certain group. There needs to be similarity. I cannot have an identity as a female if I do not share the essential traits that a female has. So this idea that your gender identity can be completely divorced from your sex is a lie. It's a delusion at best. And yet this idea of gender identity being totally separate from your body, being independent of it, is being used to justify the aforementioned medical treatments that will then secure the child as a medical patient, or rather dependent user, for life. The whole idea of transgenderism leads to potentially harmful medical treatments and evaluations, just as the definition of child abuse stated here. And yet the crazy thing is, it's been known for years that roughly 85 to even 95% of kids who had some sort of gender identity disorder or confusion, by the time they reach adulthood, are now identifying with their biological sex. But what we're doing now with getting these kids to affirm a transgender identity earlier and earlier, and to affirm it or confirm it through some sort of treatment, is we're selecting persistence rather than natural desistance. And this commits a child to cross-sex hormones, to sex reassignment surgery or gender assignment surgery or gender affirmation surgery. The puberty blockers serve as the gateway drugs to a whole life of being dependent on totally unnecessary and ultimately harmful drugs. So what are some of the risks of taking puberty blockers? Well, one, it's not fully reversible, and there's long-term complications even if the puberty blockers are stopped early. Obviously, there's the risk of infertility because it blocks the development of sperm and ova. It leaves the genitalia arrested in an underdeveloped stage. And of course, this can lead to sexual dysfunction later. For boys or males, there could be erectile, orgasmic, and ejaculatory impairment. And for females, it can induce early menopause. And Lupron, the prescription puberty blocking drug, has a package insert that warns of mental health issues like mood swings, depression, suicidal ideation, and attempts. And taking puberty blockers, which is during the body's and the skeletal system's greatest period of growth, there could be bone mineral density compromise. And there's a risk of osteoporosis or osteopenia. This can also hinder brain development milestones. In addition to all the medical risks of puberty blockers, there's the social risks and the psychological risk of missing out on that key experience that you and your peers should be going through around the same time. Now, what are the risks of taking the hormones that are predominantly in the opposite sex? Well, when boys take estrogen, the female hormone, they could end up with dyslipidemias, which is an abnormal amount of lipids in the blood, blood clots, cardiovascular and cerebrovascular disease, meaning heart attacks and strokes. And this risk increases with length of use. They can end up with breast and uterine cancer because boys now are gaining larger breasts through the hormone. Weight gain, insulin resistance. So this is terrible if you got someone already with diabetes taking cross-sex hormones. And also gallstones. When a girl takes testosterone, it could also lead to cardiovascular and cerebrovascular disease, as well as breast and uterine cancer, liver dysfunction, hypertension, severe acne, and there's a risk of liver cancer. Not to mention the voice changes. And once they stop the hormones, it may or may not go back. I've seen a lot of detransitioners who still have a very deep voice after they stopped taking testosterone. What about surgery? Sex reassignment surgeries, or SRS, are now being called gender affirming surgery or gender confirming surgery. The Hayes Directory rated it with the lowest possible rating for strength of evidence, meaning that evidence that this is an effective treatment is the lowest they could rate it. The same inconclusive evidence led the Centers for Medicare and Medicaid to not issue a national coverage determination for it. In some European countries, we have some studies that show that even in these cultures that are far more, or at least have been more LGBT affirming for longer than the US, we see evidence that even after the transsexual surgery or gender reassignment, that their mental health outcomes are still very severe and worse off compared to the general population. In 2011, there was a Swedish study of all their sex reassignment surgery patients over 30 years, a number of 324, showed 19 times the completed suicide rate 10 years after surgery. In 2019, there was a study done of the total population of Sweden, of 9.7 million residents, ultimately showed neither gender-affirming hormone treatment nor gender-affirming surgery provided reductions of the mental health treatment benchmarks examined. all the evidence shows that these claims that if you don't affirm, or if you don't help someone transition, then they'll kill themselves, it's really ultimately a myth. And it's a myth being used to emotionally blackmail families, mental health providers, doctors, politicians, the general public, into going along with a narrative that you can transition your gender or your sex, and even though it ultimately does not benefit them. Like it or not, the chemical sterilization or castration and surgical mutilation of normal sex organs in children is not healthcare. And I would say it's not healthcare for adults either. And all of this based on a false identity. A falsely induced medical symptom of believing you're the opposite sex. So, child abuse based on fabricating, exaggerating, or inducing a medical symptom or disease? I say check. The next area of child abuse is serious mental injury. The definition includes the refusal of appropriate treatment that seriously interferes with a child's ability to accomplish age-appropriate developmental and social traits. Right away, you should see that treating puberty like a disease to be avoided certainly meets this criteria. Now, puberty-blocking agents are properly used when treating precocious puberty and prostate cancer in children. And in these cases, the benefits outweigh the risks. And they're enabling a child to develop normally, to proceed through normative development. But when puberty-blocking agents are used in children with gender dysphoria, they cause disease in otherwise healthy kids. And the reality is that puberty is not a disease, but it's a normal stage of life. It should be embraced, as difficult as it can be. We all had some struggle when we went through puberty. But what we need is a society that affirms the process and the natural outcome of puberty. Not a society that treats it like it's a problem that should be avoided or should be delayed for a subsector of children. And what is the normative outcome of puberty? Sexual function. So as we already mentioned, this impairs function, and therefore this interferes with a normative developmental task. So puberty blockers and cross-sex hormones will interrupt the vital pubertal window for not just the development of your genitalia, but also a necessary window of development for the brain, bones, and psychology. And you can't get that window back. It's an utter myth that puberty blockers can be used as pause buttons to buy time to wait and see. This is a misuse of the term wait and see when it comes to the traditional standard of care for children with gender identity disorder. That, no, just wait and see, let them go through the natural process of life and see what happens when they reach adulthood. That's what traditionally was the standard of care. But now they're trying to say, no, we can wait and see by delaying the process, keep holding them back from going through that process, and then wait and see. No, you can't do that. Your body needs to keep growing. So when you intentionally impede the body from doing something it naturally should do, you're damaging the body. And yes, puberty can be hard, but delaying it actually ends up exacerbating the challenge of peer group identification and assimilation that is already fraught with problems in adolescence. Children need to identify with their same-sex peer group, which then prepares them for pair bonding with the opposite sex. This normative process gets thwarted by gender theory's agenda of marginalizing sex differences and prioritizing subjective gender identity, where it says that No, no, no. There's no real difference between the sexes except that which you actually want to make a difference. And so, whatever you think about your own sex, your own gender identity, that's what matters. That's what's important. When you give children this much power over their identity, that's a burden they're not meant to carry. They need to have some sort of culturally upheld context, a fabric that sustains them during this very confusing time. If you go and tell them, no, your identity is entirely up to you, when they're already going through all these changes, that's overwhelming. And it leaves them behind their peer group who may be going through the process in a more normative fashion, even though they're probably also going through some difficulties. And it allows adolescents to stay fixated in a regressive state of imaginary play. Like younger children who pretend to be something they're not, such as the opposite sex. They might try on different identities, and it's innocent, it's innocuous, but when you are encouraging this transgender identification, you are allowing them to fixate at this earlier stage of identity development. And it's precluding them from facing reality, the reality of what their body is telling them, that you are a boy who's going to grow up into a man, or you are a girl that's going to grow up into a woman who's going to sexually function and be prepared to give birth to another human. And that's a beautiful thing. And we shouldn't be treating that as some sort of disease, something to be avoided. Even the APA's Handbook on Sexuality and Psychology from 2014 states that premature labeling of gender identity should be avoided. Early social transition, meaning change of gender role, should be approached with caution to avoid foreclosing this stage of transgender identity development. Unquote. And as for premature affirmation, quote, this approach runs the risk of neglecting individual problems the child might be experiencing and may involve an early gender role transition that might be challenging to reverse if cross-gender feelings do not persist. So in other words, there may be other underlying issues contributing to the gender confusion or gender identity conflict. And if we affirm too early, we miss the opportunity to address those underlying issues. I cannot imagine how difficult it must be for a kid to not feel safe, to not feel comfortable in their own skin, to be comfortable in their own body, to not believe that they are the sex that they're born as, that they were assigned at birth, to believe that that's not who they really are. That must be a terrible source of discomfort and distress. And so my heart does go out to these children. But when we continue to encourage the very thing that is keeping them in that state, instead of providing true compassionate care, we're going to end up hurting them even more. And I would have to say that affirming an identity that ultimately is incongruent with reality is serious mental injury. So sadly, check on this point as well. Finally, there's child sexual abuse. And the definition includes causing a child to engage in or assisting someone else in engaging in sexually explicit conduct and conversation. Now you might be thinking, how does this count as sexual abuse? Well, let's look at conversation. This is broad, and I can see some ways that the conversation may be sexually explicit and inappropriate, especially for younger ages. When we introduce comprehensive sex ed to the earliest grades, we're prompting children to think about their sexuality prior to their ability to really understand and then consent to such conversation. And then we're encouraging them to make decisions about their sexual identity and gender identity before they can really understand the implications of those decisions. The reality is gender is not distinct and unrelated from sex. So you cannot just put these conversations about your gender identity in a separate category from talking about sex itself. We often just check our brains at the door and we forget that what are we talking about? We are talking about the way a child believes that they are meant to sexually function. When it really comes down to it, when you're talking about a child having a certain gender identity, you are talking about that child and their sex life. So let's not let the reality of this discussion escape us. We need to be very plain and clear about what it is we're discussing. We are talking about, ultimately, the sexual life of the individual. And when we're doing it at such a young age, I can see it being very explicit. Now, maybe you're thinking that's still too big of a stretch for you. But the definition also states, quote, sexual acts don't actually have to occur. Activities such as talking about, pretending, demonstrating, depicting, or modeling would all be considered sexual acts, unquote. Well, have you seen any of these drag queen story hour drag dances and the different gay pride events that they're taking kids to? Have you seen Desmond is Amazing doing basically strip teases in front of adult gay men? There's a whole world of gender affirming, at least at the social level, going on here. So, yes, there are some ways in which this is sexual abuse as well. Maybe not in general, but I would say in some cases, check. So we looked at several different components of child abuse, ranging from physical to psychological to sexual. And then we compared it to the evidence, what actually happens in transgender treatment for kids. And I think the evidence is quite clear. The application of gender theory, or transgendering our children, is abuse, and it needs to end. What's something we can do? You can support causes like Save James. If you haven't heard about James Younger and his dad Jeff trying to fight against his ex-wife who's unrelentingly trying to transition their young son into a girl, despite the boy consistently identifying as a boy, especially when he's with his dad, then contribute to that cause. The dad is continually being stripped of his powers as a father, and we're seeing a very fierce and aggressive agenda to keep this boy from being able to identify with his own biological sex. You can also try to contact your legislators, and perhaps your state will be one that will finally pass a bill that will ban gender transition for minors. We really need to see this for what it is. A society-wide act of violence against children, against their development, and a thwarting of the propagation of humanity. The very survival of our species hinges on the opposition to this dangerous ideology. So I hope I give you guys something to think about. Please engage the content by trying to leave a comment. Hitting the like button really helps. Sharing and subscribing. Until next time, God bless.